Long COVID-19 as a disability. This social story is brought to you by Chicagoland Disabled People of Color Coalition, the Institute on Disability and Human Development at the University of Illinois Chicago, Morehouse School of Medicine, National COVID-19 Resiliency Network, Crossroads Fund, and Chicago Beyond. Note: this social story is geared towards people who have or identify with having long COVID-19, as well as family members, caregivers, and providers. Though we are using the social story to inform BIPOC people in the Chicagoland area, you are more than welcome to use or modify a version of this to fit the audience in your local area. The content is for everyone. The social story is written in plain language. We try to avoid terms that only professionals will understand. We focus more on making sure that we create the social story in a way that many people can understand. The federal emergency mandate on COVID-19 will end after May 11th, 2023. This means that thanks to the efforts to get more people vaccinated, declining amounts of hospitalization and deaths due to COVID, and more accurate and proven information about COVID, the COVID pandemic will officially end. We can focus more on building a post-pandemic world where we thrive and live our full lives, similar to the world we lived in before the pandemic. For more information about the transition, visit the following website: Not So Fast. Yes, the pandemic may be officially ending, but that doesn't mean that COVID-19 is over or that we stop fighting for things such as adding people with disabilities to data sets on COVID-19, continuing to encourage public places to accommodate people with chronic illnesses, including enforcing masking policies and equitable access to personal protective equipment, or PPE, for people with disabilities and caregivers. One of the main topics that we must address in the upcoming post-pandemic world is long COVID-19. Long COVID-19, also known as post-COVID-19 symptoms or long-term effects of COVID-19, are set of conditions that you may have after having a COVID-19 infection. Some conditions under long COVID-19 can last for days, months, or even years. Not all cases of long COVID-19 are the same. Some examples of long COVID-19 effects that you may experience are unexplained or newly acquired health conditions like certain chronic illness, joint or muscle pain, fever, brain and nerve conditions such as lack of sleep, depression, anxiety, difficulty with thinking and processing information, changes in smell and other senses, and headaches, tiredness, breathing/heart conditions like loss of coughing, being out of breath, fast heartbeats, and chest pain. stomach pain. There are some people in communities that are more likely to have long COVID due to lack of health resources or supports. Those people in communities that are at a higher risk include, but not limited to, people with disabilities, people who have severe COVID 19, people who haven't had the COVID 19 vaccine yet, and BIPOC or Black, Indigenous slash Native American slash Native Hawaiian, and people of color communities, especially BIPOC communities with little to no access to top quality healthcare. Doctors and scientists are continuing to learn more about long COVID 19, how to treat long COVID 19, or how long COVID 19 can affect marginalized populations like people with disabilities or BIPOC people. CDC provides updated information about long COVID. To follow their updated information, visit their website at www.cdc.gov/coronavirus slash 2019 dash NCOV slash long dash term dash effects slash index dot HTML. Talk to your doctor or medical care provider if you feel you may have long COVID 19. CDC also provides tips that can help you talk to your doctors about long COVID 19. You can check out their tips at www.cdc.gov/coronavirus slash 2019 dash NCOV slash long dash term dash effects slash post dash COVID dash appointment slash index dot HTML. Did you know that some people with long COVID 19 identify themselves as long haulers or COVID 19 survivors? Though it started out as a social media hashtag where people could click to listen to the experiences of people with long COVID, the term hashtag long hauler is also becoming an identity that people with long COVID can connect with. Remember, never assume how a person would like to identify themselves. Always ask them how they would like to be identified as far as their disability identity, like COVID 19. If you have long COVID 19, especially if you have it for a long time, you are entitled to accommodations, accessible tools, and other benefits and resources, including Social Security disability benefits, just like any other person with a disability. In fact, in 2021, the Department of Health and Human Services posted a set of guidelines where it states that under federal law, such as the Americans with Disabilities Act, or ADA, people with COVID have access to those rights and services. You may ask, how does long COVID 19 fall under disability? According to federal law on disability, a disability is a health condition that greatly affects how you live your life in one or more ways, such as taking care of yourself, going to work, having a family, and more. You're not required to carry around a certification or any other proof that you have a disability. However, you may be required to provide documentation of your limitations or disability, like a letter from your doctor, when asking for a accommodation from your workplace or school. Because people with long COVID-19 may have barriers to living a full life in many ways, like taking care of themselves, working, or going to school. Long COVID-19 falls under the disability category. Therefore, you have a disability. You have federal rights to accommodations, accessible tools, and other benefits and resources just like any other person with a disability. Don't let anyone tell you otherwise. To learn more about your federal rights to accommodations and other disability resources, visit the Guidance on Long COVID as a Disability page at www.hhs.gov/civil-rights/COVID-19/guidance-long-covid-disability/index.html. Thanks to support from Morehouse School of Medicine and the National COVID-19 Resiliency Network, we have created a series of interviews slash podcasts called the Long COVID-19 Storytelling Series. In the Long COVID-19 Storytelling Series, self-advocate and consultant Brittany King interviews 14 BIPOC people with long COVID from the Chicagoland area about their lived experiences with long COVID or the after effects of COVID-19. Most of the storytellers also identify with having a disability. You can check out the interviews at go.uic.edu/long_COVID-19_storytelling series. We will have another series of interviews to show later this year where we focus on stories from across Illinois and nationwide. In addition, artist Icky Brittany created an amazing picture that illustrates the thoughts, feelings, and stories that the storytellers mentioned. Her picture helps us see the personal side of long COVID-19 and how it can affect people from many different backgrounds. Here are the images that Icky Brittany created. Follow her and her works at Linktree/Inky Brittany. We almost forgot to mention that there are two versions of the resource guide on long COVID. What you're listening to now is the social story version, where you can listen in or read the slides about long COVID 19. We also have a longer version called the resource guide, where we go deeper into long COVID 19, disability rights, recap of what is COVID 19 and how to protect yourself and others from infection, local and national disability resources, and more. While this version is geared more towards BIPOC people in the Chicagoland area, you can also use the guide to find resources and community in your local area. Electronic copies of both versions will be available in English, Spanish, Mandarin Chinese, and Arabic. You may access the resource guide and slides in our COVID 19 resource database at tinyurl.com slash reopening vaccine database. If you'd like more information on long COVID 19, or if you would like to follow the stories of long haulers on social media, make sure to check out the resource section in the social story. The creators of the guide would like to thank you for continued advocacy to make sure that the disability community is safe and thriving during the big COVID-19 outbreak. We would like to thank you for continued support. Check out more COVID-19 resources and information in our COVID-19 resource database at tinyurl.com/reopening-vaccine-database. If you would like to support our work through donations, please visit the following link: Disabled People of Color Fund by IDHD and Chicagoland DPOC at ahs.give-2-where-to-give. Here are some more ways to join and support Chicagoland DPOC.